Tonight about syphilis. The number of Americans diagnosed with a sexually transmitted infection has now apparently surged to the highest level we've seen since 1950. Here to talk about that is Dr. Todd Ellerin, the Chief of Infectious Diseases at South Shore Health. Always good to see you, Doctor. You've had a chance to look at this new data. What's your reaction to this?
Good to see you too, Maria. This is a dangerous trend. Think about this. We've had penicillin since 1943. Penicillin easily cures syphilis. So the fact that we're back to where we started even before penicillin now is really concerning. And I've been seeing patients increase referrals for taking care of these patients with syphilis. And it's not just gay and bisexual men, which make up about 50% of cases, but the other 50% is heterosexual men and women. So really, we're seeing really everyone being affected here.
All right, let's take a look at the numbers from 2022. Nationally, there were 59,000 people diagnosed with the first two stages of syphilis. 824 lived here in Massachusetts. And then you see the jump from just 10 years earlier when there are 15,000 cases in the U.S. and only 316 here. So what do you think is happening here?
I think it's multifactorial. Some of it may be patients not knowing their own risk. Some of it is equity and access. I want to be clear. Syphilis is not equally divided amongst us. Blacks, Hispanics, American Indians, Alaska Natives make up the majority when you compare that to whites. And here's the other thing. There's probably some fatigue, prevention fatigue, but also with the public health emergency for COVID, that diverted a lot of what was already limited resources, away from these type of, epidemiologists and public health experts that really track and test and diagnose these patients. And budget constraints are also an added problem.
Doctor, the CDC is also reporting more than 3,700 cases of congenital syphilis. That includes 11 in Massachusetts. Let's explain what that is. It's when a baby gets syphilis from their pregnant mother. So what do we need to know about these numbers? What do we need to know about that?
Well, I do want to point out that Massachusetts, of course, is listed. There were 11 cases in 2022, but we're the fifth lowest in the country. So we're doing better. But even one is too many. You've heard me say this before, Maria. Congenital syphilis has to be a never event. It's not okay that pregnant mothers are not either getting tested or they're not getting treated or they're not following up for testing. Again, this is showing that there's a major problem with access and prevention and treatment. And we need to do better. We may have to go to them.
Dr. Todd Ellerin, thank you so much as always. Be well, doctor.
You too.